Ready? Okay. Hello, everybody online. So welcome again to our Boulder County Town Hall with our Deputy Director finalists. Just as a reminder, I'm going to ask 7 questions. One will be an intro question on top of that. Our questions today are going to focus on leadership, community engagement, health equity, and workplace culture, as well as expectations. To keep on track, we do suggest pacing your responses 5 to 6 minutes, and I think Amanda's already shared with you. She'll kind of be helping track. We did also provide a copy for easy viewing, so feel free to take a look at that. Some of the questions we did provide you to in advance, some were not. So please take time, the time that you need to review, pause, and reflect. We did build time in for that. Most of the questions have multiple parts, so just a heads up. Okay, I will ask some questions and then members of our audience are going to ask you questions as well. If you do have a question, just remember to introduce yourself, your title and your pronouns, which is always my reminder to introduce myself. I'm Catherine Palmer. I'm your Director of Admin and Finance, and I use she, her pronouns. Okay, so just a few reminders before we get started. For those, again, we are hybrid. If you have joined us recently, just make sure not to turn your video on. It's just because we have technical issues in this room and one of our monitors will flash incessantly if you turn your monitor on. So the mics are hot in this room, so the camera will pick up any side chatter or other noises. So if you have anything you need to talk about, you can move out to the hallway to go do that. And that's just a reminder to also mute and put away any phones. Again, stepping into the hallway if you need anything. The biggest thing that we ask all of our participants, either here or virtually, is just to keep in line with our values. So please set aside any implicit bias you may have and listen openly with intent to what our candidate has to share with us today. And then after today's town hall, you will receive a link to complete a feedback form. And if by chance you were not able to view all of them, you'll get a link to all of them. So you'll have a chance to review all the videos. Okay, so with that, we'll get started with our first introductory question. So can you please introduce yourself and briefly tell us what interests you about this role with Boulder County and how your background prepared you for it?
Sure, thank you. I'm Corey Wilford. I use she, her pronouns. I am currently the Communications and Technology Manager at the Larimer County Department of Health and Environment. I oversee our all of our media and communications efforts, as well as our technology, enterprise system for environmental health and electronic medical record. I started off my career working in reproductive health and sexual health education. I did that for a very long time before moving over to communications. I currently serve on a senior leadership team and help guide the strategic objectives for our department. So what interests me, really having worked in public health in Colorado and being a neighbor up to the north, Boulder County is really seen as a leader in health and racial equity. It's definitely something that interests me and that I'm committed to both personally and professionally. Knowing that that's something that is at the forefront. I also talk a lot about this model of public health 3.0, moving kind of from, only doing immunizations or only doing food inspections, continuing to do those things, but also building upon those things and being more of a health strategist. So I see Boulder County working in that space, and it's really exciting for me. So I really appreciate this opportunity. As far as my background, like I said, I've worked in public health for about 25 years in all different areas. I've managed grants. I've again worked at the leadership level, worked with media, worked with a lot of community partners. And my academic background is I have an undergraduate degree in women's studies, which really at the core of that is social justice, which is similar to public health and part of what led me to public health. And then I also have a master's in public health.
Yeah, thank you. All right, our next question. This question has 2 parts. I will ask both. Please answer each separately, and I can go back to re-ask if you need. You did receive this question in advance, and it's been slightly shortened because it's fairly long. So I know you're prepared for it. If you are appointed as deputy director, you will step into an agency with agreements around fostering trust, demonstrating compassion and respect, collaborating, and building strong teams. We are also committed to being an anti-racist organization, which guides us to interrupt conversations or processes that are or may be rooted in bias and proactively support racial equity. How in your new role would you respond to and participate in positive disruption within our team? And how would you balance the need for agency cohesion and trust with the need to challenge each other in authentic ways?
Okay, big question. And I'm trying to look at you and at the camera and at you guys, so I'm
Whatever feels most comfortable.
okay. I'm trying to kind of go back and forth so we're engaging the people online too. I do have some notes on this that I'll refer to. I appreciate the question in advance. I think we're living in a society that's working really hard to uphold whiteness, unfortunately. Again, I see Boulder County really as a leader in health and racial equity. And it's part of why I'm so grateful for this opportunity. So, one of the things I saw in the first interview, and I've seen from the organizational chart, is that we have Kevlin working at the top level of the organization as health equity manager. That's really progressive, and I think that's really exciting. So I think equity work is hard work. I recognize that Boulder County Public Health works within a larger system of the county, and so sometimes that movement can be slow, working toward equity. And because of that, I think disruption is crucial to be able to move the needle forward and to be able to promote equity. So by reviewing the agency's agreements, what really stands out is this foundation of trust. I think that that's such an important foundation that all of the other agreements are built upon. And I think that if there's not trust, even if there is disruption, it's not going to be received positively if that trust isn't there. I would say that in my current role, I'm having these conversations every day as communications manager. I have to work with all of our different programs, environmental health and maternal child health and technology, our health equity folks. And in order to communicate things out to the public or out to partners, sometimes we have those disagreements of, they might want to say something one way, but I need to work on changing it into plain language. I need to think about how it's going to be received by the public or by our partners. And so sometimes those conversations can be difficult to say, I know you want to do it that way, but that's not going to land well, or that's going to come across potentially offensive to someone. So I think in those ways, I have positively disrupted conversations. I am really excited to be a positive disruptor. When I saw that question, I thought that's really cool that this is what BCPH is doing. I respond to it, I think, with positivity and an open mind. I'm willing to learn and unlearn what I don't know. And then I also think it's important to respond that way, but then also model that for other people in the agency as well. I talked a little bit about participating in positive disruption kind of on one-on-one, but also through larger initiatives. I've participated in that. The team I'm leading now recently put together a language access plan. And this was something that was new for our department. People didn't really understand why we needed this. There's internal aspects. So how do we work together as a team to make sure that everybody on staff has, that their language access needs are being met? And then how do we make sure that we're, translating, interpreting documents as well that are public facing? And one of the things that came up was that our internal bilingual staff were being asked to translate and interpret, even though that wasn't part of their role and they weren't being compensated for it. And so part of our language access plan was changing that so that it was a much more fair process, and that if people wanted to translate, they could be trained, they could receive more compensation for that. And that really kind of disrupted things. A lot of people didn't want to do it that way. They wanted to be able to grab someone and say, hey, can you come interpret for me? Can you do this medical interpretation? And so that was something that really needed to change, and is an example of how I've worked within that space. I think, let's see. Let's see. Can we read that question just one more time? I want to make sure I got all the aspects of it.
So if appointed as deputy director, you will step into an agency with agreements around fostering trust, demonstrating compassion and respect, collaborating and building strong teams. We are also committed to being an anti-racist organization, which guides us to interrupt conversations or processes that are or may be rooted in bias and proactively support racial equity. How in your new role would you respond to and participate in positive disruption within our team? And how would you balance the need for agency cohesion and trust with the need to challenge each other in authentic ways?
Okay. So I think I talked about how I would respond, some examples, how I would participate in. The agency cohesion piece, I think, is a really great question. And again, I think those values-based agreements are really the foundation for success in that space. One of the things that I think would be valuable to do, and that I'd love to have the opportunity to do in this role, is participate in some like structured listening sessions or structured feedback sessions where people are giving and receiving that feedback. So in a way, you're sort of practicing those conversations. Open and honest communication is really key. And then continuing to work on operationalizing those values like you did at the beginning by calling, that out. This is our agreement. This is how we participate. So yeah.
Okay, great. Thank you. All right. This next question also has multiple parts. I will ask them, please answer each separately, and I can go back to re-ask if you're needed. So this question is, we want to know a little bit more about you. If we were given a manual on how to best work with you, what would it say? What would the section on working with you when you're frustrated or high stress say? And what would the section on your best day say?
Okay. Let's see. So a manual on how to best work with me. Well, I have been told that I'm very easygoing, that, I am calm, I have a calm demeanor, I don't get rattled too easily. So I think that people would say that I'm easy to work with. I listen, I clarify, make sure that the direction that we're going is, a mutual direction and agreed upon. I think that, in more detailed, I work really well, like one-on-one with someone, whether that's in person or in a hybrid environment. I would much rather sit down with someone and have a conversation or do a 15-minute quick check-in than go back and forth over email. I find email to be, you lose tone, and sometimes things get missed, and then, you're not just addressing it right then. So I really appreciate those one-on-one interactions. Along those lines, I also appreciate, working with a team, being able to sit down and brainstorm, being able to come up with solutions as well. So I think that's what the manual would say. It would say, give her a call, set up a 15-minute, Teams appointment, stop by her office, that type of thing, send a chat, really anything but email. I do answer my emails, but just not as productive for me. And then let's see, what would the section on working with you when you are frustrated or high stress say? Again, and this is, with working with my boss, he'll always say, nothing shakes you up, like nothing, gets you rattled. So that's not entirely true, but I do think that I am able to be in that frustrated space productively. I'm able to move forward. I'm able to listen. I'm able to, if I need to step away and take a few deep breaths, think about, if it's a disagreement, think about, the other person's point of view. I think that's, the section would just be like, give her a few moments, ask when a good time to come back is. And, I think also just, I will come back to it, like trust that I will come back to the conversation. I'll come back to the problem or the need that was at hand. And then the section, what would the section on your best day say? I think that in a lot of ways, I love a lot of work. I love a little bit of like chaos and having a lot of things to check off on my list. That's where I feel like I'm really, really productive. Is when there's a lot of different things kind of coming at me. So I would say the section on my best day would probably be just like a, hey, good job. Like, I see you're doing a lot of work, like, way to go. I think that would be something that would be very appreciated on a day when I'm doing great, working with people, having conversations, doing this call, finishing this plan, talking to the media, whatever it is. I think, just saying you're killing it. Good job. Okay, great, thank you. Again, another multi-part question. I'll ask all the questions, and then if you need me to go back, just let me know. So with recent events that occurred just over the weekend, we are always reminded and aware of our mission and vision in public health to strongly center around and promote health and racial equity. What do you think are the most important actions for VCPH to take to advance health and racial equity, as well as social justice more broadly in our community? What kind of transformative change do you think those interventions would or could create? Yeah, thank you for that question. Again, I just want to start off that, I think Boulder County is doing such a good job in this space, and building that foundation of doing this race and equity work is essential for building a thriving community. So on this question, I got this ahead of time. I think one of the greatest things that Boulder can do is provide education and technical assistance to other agencies because you are seen as a leader in this field. Tangible materials that can help move other agencies along. One of the things that I helped create was a health equity framework or a health equity matrix, and essentially other agencies can use it to determine if the programming that they're doing, the meeting that they're doing is equitable. And so it asks a series of questions. It's really easy, and it really talks about things like sharing power and working in that space. So I think that's one of the things that I thought Boulder could do, is that, as one agency, you can't do everything on your own. So working with the broader community to help bring them along and provide those resources would be great. Building and maintaining strong collaborations and sharing power, I think, is really important. Being able to bring being able to bring data to the table, I think, is also really important. From what I know about the community health improvement plan or public health improvement plan, you have all gathered a lot of community input and some of that qualitative data, which I think is really valuable, again, to other organizations who are trying to work in this space. From that data, we can see any patterns or trends, pair it with some of the quantitative data that we're seeing, and be able to move from there along with our partners. I think another really important thing is policy advocacy. So, looking at things like the affordable housing extension that's coming up on the ballot, how can we support that as public health in order to move things like that forward. Reread that. So I think the kind of transformative change that those interventions could or would create is really this community-based, model of health and racial equity. So, Boulder County Public Health being a leader in that space and being able to help other agencies, come along with using those tools and some of that data information, talking about, again, some of those policies and how we can help gain that support for public health policies.
Awesome. Yeah, great. Thank you. Okay, so now we're going to transition questions out to our audience. So if just a reminder for those of you that have the questions, if you will please state your name, pronoun, and titles before you ask your first question.
Hi, Corey. I'm Rita. Hi again. I provide administrative support to the organization. I use she, her pronouns. And the question is, how do you decide when to dive into details versus when to step back and create and cultivate space for staff leadership?
Thank you. Let's see. Well, I think that, first and foremost, it's probably always a good idea to step back and listen to staff. I think that, in a deputy director or director role, we're not always like boots on the ground doing the work. And so I think listening to staff, listening to what they're seeing in their communities is really important. And to get that input first from, really the subject matter experts on the ground doing that work. So I think that, first of all, stepping back, listening, I think that there's also space to hear from staff if they need additional training, if they want leadership training. I think growing leaders is really important. I think that everyone is a leader, in some way, even if they're not at the top level of the organization. So I think providing those opportunities for folks to grow as well would be really important. Diving into the details, I think I would do that probably in partnership with someone else when it was somewhere that I was an expert in. Really diving in, using my knowledge and my skills to get into those details and to create a product or program in order to do that well. Yeah, I think I'll stop there.
Next question. My name is Allison. I use she, her, hers. I work in the community health division. I manage our community substance abuse prevention program. And our next question for you is, local communities increasingly face complex, multifaceted challenges. As one example, in Boulder County, even though we have a housing first approach, we see many of the unhoused caught in a vicious cycle that may be related to substance use disorder, mental illness, and housing instability. And there's two questions here. What kinds of tools or skills do you use to develop a public health approach to complex issues like this? And what kinds of questions would you ask to illuminate PCPH's role in this work compared to other partners?
Great. Thank you. I'm glad that one was sent ahead. I appreciate that. No, it's great. I mean, these are really important questions, so I appreciate the time to reflect on them. You know, addressing the social determinants of health, housing, income, you know, poverty, transportation is really where we're moving in public health. It's what we are trying to do every day. And again, that Public Health 3.0 model of embracing ourselves as health strategists is really important. So the tools that I think are really important are data, being able to bring quantitative and qualitative data to the table, being able to convene partners around specific issues. That's that health strategist piece. Being able to have that subject matter expertise, but not necessarily do all the work. I think that public health really is moving toward that, right? Not necessarily doing all the programs or seeing a problem and having, you know, to solve it with something tangible, but being able to convene partners to look at kind of those multifaceted solutions. So some of the questions I would ask, and again, this would be with convening partners, you know, across multiple sectors when we're looking at the social determinants, are what would success look like for our community? Who's already working in this space? I think that that's something that, you know, sometimes in public health, we think, oh, you know, here's something we need to solve. Let's jump in and create a program. When really there's oftentimes grassroots organizations or other organizations who are doing the work. What interventions already exist to address the problem? What data can we bring to the table, and where are there gaps in data that we might be able to collect? Who should we convene to contribute to this work? What new knowledge and expertise can public health bring to the table that isn't already there? And then also, how can we make sure that communities aren't systematically excluded from our public health services? I think is a really important thing to look at. Here we are, you know, providing services. Are we reaching who we need to reach? And then how can we strategically align our agencies to disperse work, avoid duplication, and best reach the impacted populations? So those are some of the questions, big questions that I don't have all the answers to, but I think that's where I would start.
Hi, my name is Carla, and I'm administrative support for the Communicable Disease Division. My pronouns are she, her, hers. Okay, what would you say are your leadership styles, and how will staff see them in action in different situations?
Good question. Thank you. So I would say that my leadership style is very collaborative. I really like hearing from my team. I like to come up with, you know, project plans together. I certainly don't, it's not my nature to like wield authority. My team would tell you that. I very much like to share power in group settings and in meetings with my team. I think that I'm also a bit of a visionary leader. I like to look out ahead and see, you know, here's something that needs to be changed. What could we do to make that better? And maybe not having the solution right away, but thinking about how we could get there. And always, you know, staying true to the, you know, the vision and mission and values in that. Let's see, how does staff see them in different situations? I think I'm trying to put it into words, but another area I think, another leadership style is I'm a visible leader. I like to work with community partners. I like to be at the table. I like to, provide updates or presentations to what it's elected officials or boards. I really like that part of leadership. So I think that would be both a leadership style and also how I might be seen in action, is having some of those conversations, getting out in front of partners, working together. I also, it's hard to talk about yourself as a leader. And to that end, I think I'm a humble leader. I think that I like to give other people credit. I like to work as a team. I am, still able to say no and be firm, but I am, I think a humble person and lead with that humility as well. Knowing that I might not know all of the answers, knowing that I might need to seek out expertise from someone else in the agency or someone outside of the agency, I think is really important. Yeah.
Corey, my name is Delia, and I use she, her, hers, and I am the administrative specialist of the Strategic Initiatives Branch. And question number 7, in our last couple of minutes, is there anything else you would like to share with us?
Ooh. Let's see. They said to bring notes, and I brought like a book of my thoughts. So this is who I am. I think that stepping into a role like this, leadership has shared that there's a fairly new leadership team, that there's been a lot of change. And I think that I'm really comfortable in that space. I'm really comfortable with change and with needing to learn and with needing to grow into a position and grow with a team of people. I think that I kind of jotted down just some notes because it's often a question of just like, what would you do, in your first 30 days? And I think that helps explain a little bit about who I am as well, just to share that. So, I think initially just learning any unfamiliar systems, setting goals for myself to complete would be really important. I would really look forward to working on the county's HECC, which I understand is part of this role. So, I think in thinking out ahead of that, there's some of those things can kind of relate to who I am. I think of what else you might want to know about me. Last year I taught myself how to roller skate. That was just a space filler. I think that, one thing about me in this last few years with COVID is I've had this really great opportunity to grow, as many of you probably have too. We got thrown into roles that weren't necessarily our role. We had to deal with a lot of angry public, a lot of angry people. I know a lot of us are still kind of healing from that. And so, I think what I would like you to know about me is that I am with you in that. I know that, our workforce is tired. There's national data that talks about our public health workforce being tired, wanting to leave, the field in a couple of years, feeling burnt out, feeling like they have, symptoms of PTSD. And I think that part of this role would be to really think about how we can invest in the workforce, how we can help people want to stay in public health. This is the career path I chose, and I love public health, and no virus was going to scare me away out of it. But, not everybody feels that way. This is really hard work, and public health continues to be difficult. And as we have more and more complex problems in our, in our communities, our work gets harder, and we have to work in these really difficult spaces. So I kind of just wanted to say that and recognize that in all of our, as a public health team here on the global sense. I know that that's stuff that we're all still kind of working through. So yeah, I don't think I have anything else really to add. Thank you for the questions.
Awesome. All right, so Corey, that wraps all the questions that we had for you. So the next thing will be Jordan is actually going to take you on a tour, though it might be more indoors. So we're tough since it's raining out right now. But just want to thank you for your time and willingness to come down and share more about yourself.
Yeah. Thank you. Thanks. I appreciate it. Thanks, everybody. Thanks, everybody online.